Welcome back to Doctors in the House. My name is Dr. Daryl Hill, and as always, it's a pleasure to be here with you, doctors in the house. We're in the year 2020, and there's been a lot of excitement going on with Doctors in the House. I'm very happy with the information we're bringing to you to improve your health. And in line with that, today we are going to be focusing on our kidneys. We get two kidneys when we're born, and as you might know, they're responsible for helping to keep our body clean, helping to rid ourselves of our metabolic waste, and helping to give us energy. And as some of you might know, as we get older, those kidneys, naturally the function kind of declines. And as we get older too, we got to do everything we can to help keep our kidneys healthy. You know, I don't know about you, but I know people who aren't as fortunate. Kidneys do go bad over time, unfortunately, in certain communities more than others. So today we're going to be talking about chronic kidney disease, and this month is also focused on making kidney disease more apparent and aware to the average person, because it's easy to forget sometimes just how important our kidneys are. So for those who don't know, we have 30 million people in this country with chronic kidney disease. And that equals out to really 1 in 7 people. So if you know 7 people, chances are somebody has it. Unfortunately, like a lot of issues, you don't always have symptoms and you don't always know. So, and in this particular case, upwards of 97% of people really don't know. In my office, and I'm sure with doctors' offices across this world and across this country, many people are walking around and don't have a clue about this, because early on, guess what? You don't really feel anything. You feel just as normal as you could ever be, but as things become more severe, you actually will begin to become more symptomatic. So it's really important to be getting checked out, getting tested, and doing all you can to help protect your kidney function. So diabetes, high blood pressure, those are the usual suspects. Those guys are the two biggest things that put a threat on our kidneys. So I want to remind everybody, if you do have diabetes, if you do have high blood pressure, it's even more important to pay attention. I talk about this quite a bit with my patients, and we do a lot of different things to help protect our kidneys. Because again, as you're getting older, that kidney function is going down. So it turns out about 1 in 5 people with high blood pressure, they will have problems with their kidneys. And as you know, a lot of people have high blood pressure. I'm glad we've been focusing on a lot of different strategies to protect kidneys, to control blood pressure, to improve diabetes, and to increase our health IQ so we can all stay healthy. On a personal note, you know, my mom's had high blood pressure for a long time, and it was really bad too. And she eventually got kidney failure as well and was on dialysis. So I got to see this up front and personal, in addition to patients who've gone through it. And in some cases, when we talk about patients as young as early 40s, and you can imagine that was not fun, but you know, you got to do what you got to do, because with the kidneys, you need to have them functioning for you to be the best you can be. So today, as always, we're going to be looking at a lot of different videos. These videos are going to talk about the usual causes, because in addition to diabetes and blood pressure, if you're not drinking enough water, if you're taking the wrong medications, if you have some genetic or family issues, that too can lead to kidney problems. So we're going to be looking at a lot of different things. And the main thing to remember, a lot of things can cause early and sudden injury to the kidneys, just like that. But when we talk about what we're talking about now, we're talking more about kidney function that's been going on for at least 3 months. And in most cases, we're talking about for years, if not decades too. So let me just remind you that early on, with kidney failure, you may not have any symptoms at all, but as time goes on, fatigue, nausea, problems with your potassium and your phosphorus, you can get itching, you can lose your appetite. So a lot of different things are happening. And usually, blood tests will help confirm this. You see a rise in your creatinine, and you see a decrease in your overall kidney function. And ultimately, things like dialysis and even kidney transplant are treatment options. And I've known people who've done all of those above issues with dialysis and transplant. So with that being said, I'm going to get into the video, and we're going to have a few videos to watch today, focusing on a variety of different things. So at this point, we're going to switch over to the video.
About the causes and stages of chronic kidney disease. This video is a part of the Johns Hopkins Nephrology Patient Education Program, and we like to thank our sponsors, the Ed Krause Endowment and the Shaw Foundation. So chronic kidney disease is a silent problem in the United States. There are 30 million people in the United States alone that have kidney disease. That's about 1 in 7 people. And the crazy fact about this is 97% of them have absolutely no idea they have kidney disease. That's because most of the time kidney disease is silent. There's no symptoms until you've basically lost 90% of your kidney function and you're getting close to needing dialysis. Now, a lot of people are at risk for kidney disease. 1 in 3 patients with diabetes is at risk. 1 in 5 with high blood pressure is at risk. Also, those that are over the age of 60, that are obese, have cardiovascular disease, or certain ethnic groups are at risk for kidney disease. So how do we screen or diagnose for kidney disease? Well, there are 2 tests that I use. So one is a urine test. It's a urine analysis or urine dipstick, and really what I'm looking for is blood or protein in the urine. You should not have blood or protein in your urine. They're actually really big molecules. So the example I like to use is like pasta falling through a strainer. Shouldn't happen. Or for the kidney, it tells me that there's damage to the kidney's filter that's allowing protein or blood to fall in the urine, which should not happen. And sometimes people will have this as their first sign of kidney disease before they have any chemistry changes. The next test I use is a blood creatinine test. So creatinine comes from muscle. It's just a normal waste product, but you only get rid of it through your kidneys. So when it goes up in the blood, I know the kidneys aren't working perfectly. But it's not a perfect test. If I have a 90-year-old woman that maybe weighs like 90 pounds, and I have a big bodybuilder, 20-year-old, who weighs like 300 pounds of solid muscle, they have different muscle amounts. And so they're generating creatinine at a different rate. But maybe they both have a creatinine in their blood test of 1, which is normal. But what it tells me is that bodybuilder is working overtime to get rid of creatinine. His kidneys are perfect. Whereas that 90-year-old woman, her kidneys might not be working as perfect as they used to. Because really, she has no muscle mass, and her creatinine probably should be like 0.5. But instead of me guessing this, we have something called a glomerular filtration rate. And it's really a calculation where we take into account your age, your race, your gender, and your creatinine level. And so what happens is if your creatinine goes up in the blood, I think your kidneys aren't working great. Well, the glomerular filtration rate works the opposite way. It decreases when your kidneys aren't working great. So they move in opposite directions. So what really is this glomerular filtration rate? Well, it's literally a measure of how many milliliters per minute of blood your kidney's filtering. But for me, it tells me how much function of your kidney that you have. So normal is about 90 to 100, and it decreases as the kidney ages over time and as the kidney disease gets worse. And I use this glomerular filtration rate to stage kidney disease. So what are the stages of kidney disease? So there are 5. And the first stage is when that glomerular filtration rate is more than 90. But maybe I know that there's damage to the kidney. Maybe I have a kidney biopsy. Maybe I have blood or protein in the urine. Then stage 2 is from 60 to 90. Stage 3 is from 30 to 60. Stage 4 is from 15 to 30. And stage 5 is less than 15. Usually as a kidney doctor, I don't start seeing patients till around stage 3, 4, or 5. And most of the time, if somebody's in stage 4, that's when I start the discussion with them about, well, in the future, if your kidneys got worse, are you thinking about dialysis or transplant? And I talk to them about the options. We don't start at them, but we start talking about it. And then in stage 5, really, it's not until that glomerular filtration rate is about 5 to 10 before people start to develop symptoms of kidney disease. And that's when they usually need to start dialysis. So I use the stages of kidney disease a lot as a kidney doctor. One, it tells me how well your kidney disease is, if it's progressing or not. And two, it tells me how often I need to get labs and how often I need to see you in clinic. Because somebody in stage 2 compared to stage 4, I'm not going to see someone in stage 2 that often, maybe once or twice a year, whereas somebody in stage 4 I might see every 3 months or every 2 months. It depends on how their kidney function is trending. There are a lot of different causes for chronic kidney disease, but the number one in the United States and in any developed country is diabetes. Diabetes can affect any organ in the body, and it's known to affect the kidneys if it's not controlled. High blood pressure is the number 2 cause for chronic kidney disease in the US. And then after that, it's kind of a mixture of things. So there's a category called glomerular nephritides or glomerular nephritis. And really this is a group of diseases where your body's attacking your kidneys. You're making some sort of antibody, maybe due to things like lupus or something else, or you have a disease specific to your kidney like IgA nephropathy or membranous nephropathy. Some other causes, there's inherited diseases. So a good example of this would be like polycystic kidney disease, where your entire kidney gets replaced by cyst. Then we have some other diseases, so like urinary tract obstructions. So the most common is for men having prostate problems. Well, like I explained in one of our other videos, is going from your bladder out of the body is your urethra, and for men that goes through your prostate. So if your prostate enlarges, it basically pinches off that tube and you can't get rid of urine. Well, that backs up to the kidneys and causes damage. For women, this could be uterine fibroids that can cause obstruction or blockage. Also, repeated kidney infections can cause damage to the kidney. So if I have an actual infection of my kidney, that can cause scarring over time. And then sometimes we have medications. So every medication has side effects, and sometimes medications are necessary, but sometimes those medications can cause damage to our kidneys. If you're interested in learning more about chronic kidney disease, causes and stages, then check out our resources.
Coming to an end.
Also, if you want to know about normal kidney function, the complications of kidney disease, or treatment of kidney failure, check out our other videos.
Yeah.
Hello. Welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is...
So one thing's for sure is no one wants kidney problems. And just like the fear of diabetes, I find the fear of kidney failure gets people real nervous, because there's nothing like that image of having to be on dialysis. It really scares people. So the name of the game is what? The name of the game is prevention. So we're here to learn and to prevent any problems with our kidneys. So we heard about diabetes and what it can do to the body, and especially the kidneys, not to mention the blood pressure. So going forward, a huge issue will be to protect those kidneys and to do the right thing with managing our chronic medical issues, and on a daily basis, just doing a really good job with our diet. We heard that a nephrologist is the kidney doctor. They're the ones who manage dialysis. They're the ones who really help pay special attention to our kidneys when we need the help, because the truth is so many different things can affect your kidneys. You heard about glomerulonephritic diseases, where different antibodies and parts of our body are attacking our own body. She talked about structural problems such as polycystic kidney disease. These things are real. There's also situations, and I saw this once, where you can be born with one kidney, and the person I'm thinking of, he didn't realize he had one kidney until much later in life. So a lot of things can go wrong, but again, important to be on top of things, important to be getting your blood work, your urine work, and more importantly, just to make sure there's a good relationship with a doctor to stay on top of things. In addition to the testing we talked about, other testing include things like an ultrasound, which is a pretty simple way to rub a probe over your back, very non-invasive, and to get images of your kidney. And with that, you can actually see structural problems. And of course, things like a CAT scan can give a lot of information too. We can't forget that cancers of the kidney can happen as well. We got to be apparent that, you know, so many different things can go wrong, and it's up to us to be paying attention to these things. I do want to mention about a patient, John Doe, we'll call him. And John Doe was somebody who had blood pressure and diabetes problems for a long time. And even though he was under great control with blood pressure and diabetes, he still, because diabetes, even when controlled, can really hurt the body, the kidneys, based on the duration of time. So after 30 years of having diabetes, he had clear evidence of kidney failure and eventually had to go on dialysis. And as he got closer to needing dialysis, he became more tired, more sluggish. And we saw that his potassium started increasing, because as your kidneys fail, they can't do their usual job, like get rid of your kidney, get rid of your potassium, and manage your phosphorus levels too. And that's why you find that when patients are dealing with dialysis, there are other medicines they have to take to help manage their electrolytes. In addition, they're taking different medicines too to protect their bones, because while this is happening, your bones are being attacked for a variety of different reasons to help manage some of the physiologic changes taking place with your kidney failure as well. So what I'd like to do at this point is just to take a pause. We're going to go to a quick break and get into our next video. You're listening to Doctors in the House.
The symptoms associated with chronic kidney disease worsen as you progress from the least severe stage, stage 1, to most severe stage, stage 5. Patients who have chronic kidney disease stage 1 usually have no symptoms. The only exception is patients who are spilling a massive amount of protein in the urine, because they can subsequently develop swelling in the legs or other parts of the body. Now, chronic kidney disease stage 2 is usually associated with no symptoms either, just like stage 1, you don't know. The vast majority of patients with CKD stage 1 and 2 are not aware of having kidney disease unless they undergo specific blood and urine testing. So most of the time it's incidental finding. You are not even looking for it. Now, chronic kidney disease stage 3. This is the most common stage of kidney disease. This is middle road. Your GFR is between 30 and 59. Since this stage is associated with moderate reduction in level of kidney function, a proportion of patients might develop some symptoms. And what kind of symptoms? Some of those symptoms, like fatigue, or more frequent urination at night are non-specific and overlooked by patients or attributed to some other things going on in their lives. Think about this. There's a very long list of causes for fatigue, and kidney disease is certainly not number one. Some patients who are in chronic kidney disease stage 3 can experience swelling in the legs. Now we're moving on to stage 4. Stage 4 is associated with further reduction in the level of kidney function. It's considered severe. GFR is between 15 and 29. Thus, as you can expect, there will be more patients having symptoms in this stage. Symptoms can be similar to those with stage 3, but they're just more obvious. There might be some additional symptoms like decrease in appetite, or some patients will experience shortness of breath. Now we are moving to stage 5 chronic kidney disease, and this is the most severe stage. If you recall, in stage 5, GFR is less than 15. As with other stages, various patients will experience different amounts of symptoms. There are certainly many people in this stage who continue to work full-time and live a pretty much normal life. You look at them and you would never guess that they have chronic kidney disease stage 5. They ask me, "Doc, are you sure? I feel just fine. I cannot tell." In general, however, in this stage, there are more symptoms than in any other previous stages. On top of previously mentioned symptoms like fatigue, swelling in the legs, patients might suffer from some other symptoms like skin itching, metallic or bitter taste in their mouth. Sometimes I ask patients, do you feel like you swallowed a coin? Not that I know what it tastes like, but it's just that your taste is off. Sometimes patients experience nausea or even vomiting, and this nausea and the vomiting might be more pronounced in the morning. When you're in stage 5, you can expect further worsening in energy level and some sleep disturbances. Some patients will require more sleep at night. For example, instead of your previous 6-7 hours, which was enough to feel refreshed, now you will need 9 hours to feel rested or semi-rested. Or maybe you're going to have a reverse sleeping pattern. That means that you will stay up at night, you're just not sleepy, you cannot sleep, and then you will want to sleep all day long. Or some patients, they sleep at night just fine, but they also require a nap during the day. They will tell me, "Doc, I go to work, I can get through work, but then when I come home, I really need this nap," and they didn't need it a year ago. Many patients, when they are in stage 5 chronic kidney disease, they are in denial. All those changes are very slow. It's not like one day you have 100% of kidney function and the next day you wake up and your level of kidney function is down to 10%. So you really have to pay attention to your body, how you feel. We tend to adapt. If I have less energy, all right, I'm not going to run, I'm going to do less. I might sleep more. Oh, I don't have an appetite, so I will eat less. But sometimes people don't notice. So when you come to see us in clinic, especially when you're in chronic kidney disease stage 5, we'll ask you very pointed questions. How much do you sleep? How many hours? Well, how many hours did you sleep a year ago? How much do you eat? Well, is it up or is it down? All those questions are helpful. Some patients in chronic kidney disease stage 5 suffer from muscle cramps even when measured electrolytes in the blood are normal. Sodium is normal, potassium, magnesium, so please do not self-medicate yourself. Don't just start taking magnesium supplements when you get cramps because you might overdo it. You might notice worse concentration, or actually you might not notice, but somebody else around you will notice that you are not as sharp as you used to be. Some patients might feel more cold than usual than previously. Your urine volume might drop, you'll be peeing less than you did previously, and maybe swelling in your legs will get worse. Sometimes when you are in stage 5 chronic kidney disease, blood pressure control becomes more difficult. We have to add another agent and blood pressure keeps creeping up. Patients who have diabetes might have more episodes with low instead of high sugar. That's one of the findings of advanced kidney disease. To summarize, please remember that chronic kidney disease is a silent disease, and some patients will have just non-specific symptoms only, which are often ignored or overlooked till kidney disease is quite advanced. Let us go through a couple of questions to check your understanding of this module. Question number 1. Which stage of chronic kidney disease is associated with most symptoms? The correct answer is chronic kidney disease stage 5 is associated with most symptoms. This is the most advanced stage of kidney disease. If symptoms are severe enough and or some of your labs are dangerously abnormal, you might need to start either dialysis or undergo kidney transplantation in stage 5. Let's do one more question. Which symptom would you not expect to occur in chronic kidney disease? Is it A, fatigue, or B, leg swelling, or C, increase in appetite, or D, muscle cramps? Let's think about this, and which symptoms would you not? It's a tricky question. And the correct answer is C, increase in appetite. If anything, there is decrease in appetite in advanced kidney disease. Some people lose weight. All other symptoms often occur in patients with chronic kidney disease. So you will experience fatigue, leg swelling, and muscle cramps. All right, congratulations to you guys. You have completed the module on symptoms of kidney disease. Please check our website for additional educational modules on kidney health. Thank you.
In this film, we're going to explain
Very good. So nothing like a quiz or test to remind you how smart you are about dialysis and kidney failure. Just joking. This is a very serious topic, and I'm hoping that we learned something from that video. And what that video was reminding us of is just how common kidney failure is, and more importantly, how a lot of times there are really no symptoms until later. So without being tested, there's really no way to even know that you have a problem. So again, want to remind people, very, very important to be getting checked out with seeing your doctor, getting the right blood tests, things of that nature. Just kind of queuing up another video for us because these videos are very, very helpful. A lot of times you talk to people and people wonder about, do I drink enough water to help my kidneys stay healthy? And some people get pain in their back and they get concerned about the kidneys. And most of the times when we talk about kidney issues, as we've mentioned, there are really no symptoms or anything, no real pain, nothing like that. So what I'd like to do now, we're going to be getting into a little bit more of a situation where a patient gets to describe some of their symptoms of kidney failure, not to mention being on dialysis. You can only imagine what it's like to sit in that dialysis chair hooked up to a machine 3 times a week for upwards of 4 to 5 hours with your blood being pulled out of your body, run through a machine, and then put back in your body. From what I'm told, it can be very exhausting, and not to mention the time you have to allocate to sitting down. And just as a side note, you can have something called hemodialysis. Those are the people who pretty much sit in a chair hooked up to a machine. But there's also something called peritoneal dialysis, and it tends to be that a younger person will do this in their own home because it gives them more control over dialysis, and they can do it in the comforts of their own home. Of course, with all of these issues, you got to wonder about the possibility of infection and things of that nature. So at this point, we're going to go ahead and get ready to show the next video, and we'll talk a little bit more later.
We all have bad habits, whether it's biting our fingernails, procrastinating, watching too much TV. There's a million of them. But there are 12 of them that can cause damage to your kidneys. And let's get right to those. First, not drinking enough water. Your kidneys remove toxins and waste from your blood. They need water. That's the fuel that they use to pull those things out of the blood and flush them down to your bladder as urine, where you can then pee it all away and flush it goodbye. Not drinking enough water removes that fuel that your kidneys need so they can do their job. Also, being dehydrated can increase the rate at which your kidneys fail and they're just not working. Don't get dehydrated. So how much water should you be drinking? You should know this. 1/2 your body weight in ounces every single day. Next, when nature calls and you gotta go, not going is a problem. You need to empty your bladder, get that all out of there. Holding it, first of all, there could be some bacteria in there. Not always, but there could be. And you're just exposing your body to it longer. You don't need that. And holding it puts stress on your kidneys. So when nature calls, you gotta go. This one I've mentioned so many times, and your doctor has mentioned it. Too much salt in your diet. You should not have a salt shaker at your table. No, there is more than enough salt for what your body needs in all the food that you eat. Practically everything has salt. Even an egg. An egg has salt in it. Quite a bit actually. Reduce the amount of salt. That means not adding it, reading labels, looking for what the sodium content is. They pack a lot of salt in food, and watching out for processed meat. Most people should only eat 1,500 to 2,000 milligrams of salt every day. And if you're not adding salt, you'll probably hit that number pretty easy. Next, we have not getting enough sleep. And I know, for those who already have kidney disease, this is a tough one. It's very common for you to go to bed, wake up an hour, 2 hours later, and be wide awake for many, many hours, and then fall asleep again. It's almost like you're taking cat naps at night, but your body needs the rest. When you're sleeping and resting, your body's repairing itself. It's repairing the organs and the cells. Just the sunlight, the ultraviolet's doing damage. Your body needs that time to do all of its stuff, take care of itself. It's busy working. As a matter of fact, did you know that when you're sleeping, your body uses more protein than any time during the day? It's because it's building muscles, repairing those, and working on your bones and all that stuff. So give your body time. Make sure and get as much sleep as you can. You should be shooting, for the average, probably around 8 hours a day if possible. I know with kidney disease, it's 8 hours would be a miracle. It'd be amazing.
Hi, I'm Rex Moore with the Motley Fool in front of BMW's self-driving exhibit at CES.
All right, this one's a big no-no. You've heard this one before. Hopefully, don't use painkillers. Don't overuse them. Especially the NSAIDs ones, non-steroid, anti-inflammatory drugs. Those are really bad. They can cause kidney damage with a large dose or even small doses used over a long period of time. Even Tylenol, which is one of the safer ones for those who already have kidney disease, can cause problems. Now, it usually damages your liver, but you got to be careful with pain relievers. If you have a headache, there's these cold compress things you can put on your forehead. They stick on there. They usually work great. They work fantastic for me. Maybe you can take a shower. Maybe you can go for a walk. Maybe you can do some stretching. Try to find, if possible, alternatives for all these minor aches and pains that you may want to pop a pill, but maybe you can get by without a pill. You don't want those adding up over time. That's how my kidney disease, my kidney damage, my chronic kidney disease, came to me. It was from overuse of Advil. Now, I was not popping pills like crazy. I was taking less than the daily dosage. Problem was, because of my back, I was taking it for almost a year, and it just destroyed my kidneys. All right, so when it comes to pain pills, try to skip them as much as possible. Only use them when absolutely needed, and only use the amount you absolutely need. All right, now this one's a bit of a tricky one. Excessive caffeine intake. You're consuming too much caffeine. For those that are consuming too much caffeine or tons of it, you're increasing your blood pressure, you're restricting the size of your blood vessels. That can lead to kidney damage. Now, you don't need to stop all caffeine, because believe it or not, there is research out there that shows having a few cups of coffee a day are good for your kidneys. They can help people who have kidney disease. Just be careful. Don't get crazy. Don't be eating tons of chocolate. Don't be taking lots of energy drinks. And don't be down in 6, lattes every single day. Excessive caffeine is bad for you. But a few cups of coffee are actually good for you. Just be careful what you add to it. That creamer, all those other things, they can be loaded with phosphorus, potassium, calcium. There's protein in there. All sorts of hidden things in those additives. So, no excessive caffeine, but that does not mean no caffeine. If you enjoy coffee, have a few cups every day. It's good for you. Alright, this one's a pretty easy one. Alcohol. Don't excessively use alcohol. As a matter of fact, alcohol use, if it's excessive, over doubles your chances of having severe kidney damage. So, avoid alcohol. I don't drink any.
So here we go. I think you guys get the drift. Definitely some more information I want to get through, but obviously there are some things we don't want to do when it comes to trying to protect our kidneys. The NSAIDs are a big one. We have access to a lot of pain medications over the counter, and we got to be real careful with the Motrins and the Advil. There are a few more things I wanted to get into, so I'm going to switch over to one more thing here. Hold on one second.
You can't live your life to the fullest if you spend it worrying about money. That's why every man or woman.
So this video here is going to get into a little bit more about kidneys and what you should be eating. So we're going to switch over to the video now.
And I am trying to do something that I have not done before, and that is sharing my screen. Okay, so I'm going to try to share my screen and share and, keep myself on the camera. So bear with me for a minute because I want to close out my camera a little bit more. I want to close out there we go. Okay, here we go. Okay, so I think I'm good here. Let me just move myself a little bit to the side. And here we go. Okay, so hi Veronica. Veronica is giving me a thumbs up. So if you are here, you're watching me, if you want to say hi. Sharon Paz is giving me a thumbs up. So thank you so much for watching. And let's go ahead and start with this is going to be a short class, real fast. Okay, so I am going to go ahead and share. Give me 1 minute. Okay, so now this is what we're going to do. Okay, so I'm going to be talking about how to know if you have kidney disease and how to slow down the process, which is super important. So with the renal anatomy, what most people have, the normal renal anatomy, is that we have 2 kidneys, and they are about the size of a fist, and they weigh about 5 ounces, each of them. So if you do a fist like this, okay, so everyone do a fist like this, and look at it, that's the size of your kidney, okay, that's the size of your kidney. If you do 2 fists, these are the sizes of your kidneys, and they're located in the back of the body, like around this area. So they're like around this area over here. So I hope everyone can see around here, okay? So they are protected by pads of fat and the rib cage, and they have millions and millions of nephrons. And nephrons are going to be the cells inside of the kidneys. There are two different types of kidney disease. One is called acute kidney failure, which is AKF. We recognize it as that. And the other one is chronic kidney disease, which is CKD. Okay, so acute kidney failure could be due to an accident, trauma, or a person that had a drug overdose, medicine, stuff like that. In acute kidney failure, it could be reversible, so the person could have kidney function again. Now, in chronic kidney disease is a slow loss of nephrons, of the kidney cells, okay? So it's gradually, the kidney function will go down and down and down, and unfortunately, that one is non-reversible. Okay, so once we lose nephrons, that's it. Those are lost. We cannot regenerate new cells in our kidneys. Okay. The initial screening for CKD. So how can you know, if you have kidney disease or not? You can ask your doctor. You can ask your doctor for a simple screening. It's very simple. The screening is a urine test, a simple urine test, and a blood pressure check. Those two things can give you like an idea if you have some type of kidney failure or if you are at risk for kidney failure. Okay, so when you go to your doctor, just ask for a urine test and a blood pressure check, and that's going to be the initial screening. If something comes out of range, then the doctor is going to perform more testing. Another very common test that the doctors perform is the creatinine. Let's see how the creatinine is, okay? So let's talk about the stages of CKD or chronic kidney disease. So when a person is already diagnosed with chronic kidney.
So we are back to me, Dr. Darrell Hill. Some of the stuff you were about to hear, we've already heard. So I'm going to take the liberty of switching us to some other information that might be a bit more valuable. But I like how in that particular video, she once again emphasized just how important blood pressure is. And when she talked about the urine test, that urine test looks for protein in your urine because, as mentioned earlier, you really shouldn't have certain proteins in your urine unless you're having some problems with the kidneys doing their usual job. So, I got a few quick, really important videos, and we're going to run through them real quick because the information is very important. She's going to talk a little bit about dialysis. It's going to talk about how diabetes can hurt the kidneys, and it's going to remind us how certain medications can help to prevent kidney failure. So I'm going to go ahead and click on this first video, and I think we're going to be ready to go. Just bear with me here. I think we're good.
Some people lose their kidney function. It's either due to chronic illnesses. The most common form of chronic kidney disease in America is diabetic kidney disease. In addition to that, people lose their kidney function acutely, suddenly, due to a catastrophic illness or some intermittent reversible illness. When that happens, people need acute dialysis as a life-saving treatment to allow them to have a reversible of their acute medical problems and survive. The dialysis is typically done either in the intensive care unit or here in the inpatient dialysis clinic at Piedmont Hospital. Often dialysis is a bridge to transplantation, and people on dialysis are often on the kidney transplant waiting list, and hopefully at one point in the future will get a kidney transplant either from a family member or a loved one, or alternatively through the deceased donor kidney waiting list. Dialysis is done typically in two different ways. The most common way it's done is a treatment called hemodialysis. Hemo refers to blood, so in this treatment blood is removed from the body, treated through a dialysis kidney filter, and then returned back to the body. People on this treatment can have a normal daily lifestyle. They are able to participate in their normal daily family activities. A lot of people on this treatment can go to work on a regular basis and are able to have a good quality of life. The second form of dialysis is called peritoneal dialysis. So peritoneal dialysis that allows people to do the dialysis treatments in their own home. treatment involves using your own body, using the peritoneal cavity to do the dialysis. Fluid in the peritoneal membrane can be exchanged to remove kidney poisons and extra fluid, and therefore allows the individual to replace their kidney function and restores them to good health and normal daily activities.
In the next 60 seconds, I'm going to show you how to naturally regulate your blood sugar and naturally increase.
Okay, that might be it. Let's see what happens here. This might be it for that video. You can let it play.
Diabetes is a condition where the sugar level in the blood is raised. Now, we all have sugar in our blood, and this is very tightly controlled by insulin, and there are other ways in which the sugar levels are kept under tight control. Now, diabetes happens when the control mechanisms are defective, and the high sugar is quite poisonous to the internal organs, particularly the blood vessels in our body. And in the initial period, the complications start to build up, but it is not felt by the patient for a long time. It may be anything up to 10 years before complications from damage to the small blood vessels, especially the capillaries, start to show up. So we could call this a silent killer for that reason. The smallest of blood vessels are damaged, particularly in the back layer of the eyes and in the kidneys, and also those blood vessels supplying the nerves. So we have a problem with vision, kidney damage and nerve damage, which will show itself up in the form of a leak of protein and gradual accumulation of toxic products because of the kidney failure. And then at that point you'll start to feel ill, and most of the time when you see the doctor, it is fairly late in the day, and the time where you could actually prevent the development of these complications was when you were feeling well but living with high blood sugars. So the important message is to screen. People are screened to detect high blood sugars and then manage to keep the blood sugars under strict control if you are to avoid running into serious problems 10, 15, 20 years later. You must also remember that high blood sugars are associated with high blood pressure, high cholesterol, and excess weight, lack of exercise. This entire package, and also you must not forget cigarette smoking. All these things contribute to heart attacks and strokes at a young age. And sugar control for that reason is extremely important, along with stopping cigarette smoking, controlling blood sugars and cholesterol, keeping your weight.
So we are back with Dr. Hill, and just want to touch on one or two more things as we wrap up the show. So I had to go ahead and abbreviate that particular video, and I want to get into another video real quick before we go. And if we can go ahead and get that ready to go, let's go ahead and switch over.
For kidney disease?
Well, most people with diabetes or high blood pressure, which are the major causes of chronic kidney disease, are on a number of medications. They're on medications to control blood sugar if they have diabetes. They're on medications frequently for blood cholesterol, and they may be on other medications. Controlling high blood pressure is very important, and most people with chronic kidney disease require several medications. Among the medicines that we use to control blood pressure are two kinds of medicines that have a specific benefit to the kidney. They not only lower blood pressure, but they are actually known to protect the kidney from damage. Those medications are either ACE inhibitors or angiotensin receptor blockers, also known as ARBs. Many people with chronic kidney disease benefit from being on these medications among all the other medications that they might be on.
What about a water pill?
Well, many people with chronic kidney disease and high blood pressure are on what's known as a water pill. The medical name is a diuretic. And it's actually not a water pill. It's a pill to help your kidney get rid of salt. And as it gets rid of salt, the water follows. People can avoid having to take a water pill or a diuretic, or may be able to reduce their dose if they're careful about the amount of salt that they eat.
I've really gotten well over 260 pounds.
I'm going to skip it in a second. There you go. I think.
Hi, this is Dr. Pallavi Patri. I'm one of the nephrologists working at Columbia Asia Whitefield Hospital. So blood pressure and kidney disease are very closely related to each other. In certain cases, very high blood pressure in certain types of hypertensive conditions can actually damage the kidneys and cause chronic kidney disease. And the flip is also true, where chronic kidney disease in a patient that did not have a blood pressure problem to begin with can cause high blood pressure. So the kidneys are very important in regulating salt and water levels in the body. And when the kidneys don't work so well in the setting of chronic kidney disease, salt and water are not excreted well from the body. So salt and water accumulate, and when this happens, the blood pressure can rise and the patient develops high blood pressure. So in patients who have chronic kidney disease and have developed high blood pressure thereafter, it is important to follow certain dietary restrictions. A low salt diet is very important, and in more severe stages of chronic kidney disease and in what we call end-stage kidney disease, where patients are on dialysis, they may have water restrictions as well. The amount of fluid that they can take in a day may be restricted. And also in correlation with that, a lot of patients who have chronic kidney disease and have high blood pressure, the medications for blood pressure may be a little more specific to their kidney disease. They may be required to take diuretic medications, again, to excrete more salt and water. So blood pressure may be managed a little bit differently in the patient who has chronic kidney disease. They may also be on certain medications that control blood pressure that are protective to the kidneys in the long run.
That might do it. Yeah, so I'll just talk and close this out. So you are back, doctors in the house. My name is Dr. Darrell Hill. I'm with Laurel Medical Associates. We can be reached at 301-497-0401, or also on the web, laurelmedicine.com, where we keep a host of what I consider important videos for you and for anyone who's trying to learn more about health issues that matter for their health. We got some really good ones, including this one now on kidney disease. So we talked a lot today about kidney issues, and towards the end, we started talking quite a bit about the amount of salt in our diets. We've got to get on top of our salt issue, and we've got to really control the blood pressure, control the diabetes, and do the right thing. More than anything, we got to make sure we're getting tested for these things, and that we're every day eating right, getting our exercise, and just spreading the word to everyone to take care of our health. So we're going to continue to bring videos and content that matters, that helps keep you healthy. I can't believe it. We are already into March. It's been 3 months so far into the year 2020. And our goal is to continue to get the word out so that we all can be healthy. So that pretty much will wrap up our show today. Again, my name is Dr. Darrell Hill with Doctors in the House. We are in Laurel, Maryland, 301-497-0401, and we are always on the web, laurelmedicine.com. Until next time, take care of yourself.